All right. So, welcome to our chat and chew today. Our chat and chew is about don't suffer, get the right puffer with our guest host, Stacey McNeilly. And as we move into this, we'd like to do a quick land acknowledgement. So we're on the lands of the Coast Salish peoples. We live, work, and play on these unceded ancestral territories of the Squamish, Musqueam, and Tsleil-Waututh nations. And if you'd like to share your the lands on which you live, work, and play, please feel free to pop that in the chat for us. And we do want to create a safe space where everybody is respected. So we join this conversation willingly with open hearts and open minds. Everyone's free to share their thoughts, values, and opinions without fear of judgment and ask questions. Information that is shared here is just for educational purposes only, and it does not replace any professional medical advice from your healthcare providers. And as we chat and chew, we're going to get off topic, and that's okay. We might nudge the conversation back to inhalers, inhaled medications today. And we will formally end it after about an hour, and then we will end the recording. And if you'd like to stay on to ask some extra questions, feel free to do so for a few minutes after that time. And we'd like to take this opportunity to tell you about some other upcoming free events that we have. We have an inhaler workshop about the Breeze Haler on Thursday, September 26th at 1 p.m. Pacific. And stay tuned for information about our upcoming Harmonicas for Health and Happiness program. This is a free program starting in October. We're doing 5-week sessions over the next 10 months. So do stay tuned for more information about that. Maybe sign up for our newsletter. And without further ado, get comfy and let's chat and chew. So we will introduce our wonderful guest here. This is Stacey McNeilly. Stacey is a registered respiratory therapist and a certified respiratory educator. She is an asthma specialist, and she works with Fraser Health, working with people living in the community there, supporting them. Thank you so much, Stacey, for joining us today.
Oh, thank you for having me, you guys. This is wonderful. So yeah, I've been a respiratory therapist for over 25 years, and that sounds better than saying the actual year because we don't want to talk about that. And I've been an educator since about 2009. And I worked at Eagle Ridge initially when I was an educator, then transitioned to Ridge Meadows Hospital, where I met Barb. And I was there for almost 15 years. And I was the coordinator for the asthma clinic, the pulmonary rehab, and the smoking cessation clinic, the lung health clinics. And then about a year and a half ago, it was time for a change. So I ventured off into primary care, into community. And so now I'm with Community Respiratory Services, which has been a wonderful change. So today we're talking about inhalers. I just want to get a lay here of where you guys, so do any of you have asthma? Tina and Jenna do. Okay, what about COPD? Is that?
I have that.
Okay, you guys are COPD. So I'm going to mention asthma, but I won't say too much. Just that it gives you guys a bit of an overview. Okay, and what I'm going to start with, I'll start with a bit of a PowerPoint just to get us going, but please interrupt anytime, ask questions. Oh, here's Jeannie as well. I'll share my screen in just a second here. So first of all, we'll talk about a bit about asthma. So Jeannie, do you have COPD?
No, I've got pulmonary hypertension and pulmonary fibrosis.
Okay, do you take any
Secondary to
inhalers?
scleroderma.
Okay, do you take any inhalers?
Yeah, I take Zenhale.
Perfect. Okay, so this is perfect for you then. Okay, thank you.
Thank you.
So asthma, pretty just a good overview on asthma. If you guys can see my pointer, this side here. The left side is a normal airway with no asthma. So you can see how it's nice and open and clean. The muscle's not tight. There's no mucus. If you put a camera down, you would see that there's no inflammation, no swelling. Somebody with asthma, what happens is on this right-hand side, you get all this constriction of the bronchi that gets bronchoconstriction. And then inside the actual airway, you can see it's just a hot mess, lots of inflammation, lots of mucus, lots of swelling. So this inflammation, it causes symptoms, cough, shortness of breath, wheezing, chest tightness. It says oppression. And at first I'm like, what is that? Because this is from a French site back east and it was translated, I guess, right? So I'm like, oppression says chest tightness. That's what that's supposed to mean. And then secretion, mucus production. And if you put a camera down, you can see all that, the difference between no asthma, how much inflammation there is. So what are the triggers for asthma? Typically, inflammatory triggers, allergens. A lot of times it's animals, cats, dogs, dust mites, molds, pollen. Somebody gets a respiratory infection, that's their main trigger. Workplace, that could be, people working in cedar mills, any kinds of mills with dust, mechanics, that's what that's showing, painters, anything with chemicals, anything you can smell. Some hairdressers I've seen over the years inhaling all the different hairsprays and chemicals from perms, the fine hair particles they end up when that's the only thing we can contribute their asthma to. Irritants that trigger asthma, change in temperature, of course, right? We get a lot of that here. Exercise, exertion, cold air. We don't get that too much here, but the really cold air where you have to put a scarf over your mouth. Stress, emotions. Well, we don't give that enough credit. That can really trigger asthma as well. I always say around Christmas, dealing with in-laws and family, right? A lot of times there's extra stress and a lot of times people have trouble with their asthma. Strong odors and fumes, paint solvents, any kind of cleaning chemicals, anything you can smell. Of course, cigarette smoke, any kind of smoke. Other things, tobacco smoke, we should also include their vaping, marijuana. Gastric reflux, that can be a trigger. Air pollution, indoor or outdoor. And food additives, typically MSG is a typical one for some asthmatics. Red wine has sulfites, metabisulfites. And some medications can trigger asthma as well. So that's just a bit of an overview of what triggers asthma. And now, what is COPD? You guys are all very familiar with COPD. So COPD is that umbrella term, and I'm sure you've talked about this quite a bit with this program. The two things under the umbrella of COPD, we talk about chronic bronchitis and emphysema. So chronic bronchitis on the right-hand side, you look at a normal airway with no bronchitis, and somebody with chronic bronchitis, you can see how it's inflamed and there's swelling, there's lots of mucus, thick, sticky mucus. It lines the airway, makes that airway narrow, hard to breathe through. And then over here you have emphysema. Emphysema, here's a typical alveoli without any emphysema. It looks like, I always say it looks like a cluster of grapes. You can see that the air, you have all your vessels inside, your arteries and your veins, and the oxygen's coming in, you're breathing out your carbon dioxide. And somebody on the other side here with emphysema, what happens? That alveoli becomes damaged for whatever reason. And now instead of being like a bunch of grapes, it's like a paper bag. So if you think about a paper bag, if you blow up a balloon, for example, you blow up a balloon and you let go of it, what happens? It has elastic recoil. It comes right back down, right? Somebody with emphysema, it's like a paper bag. So if you blow up a paper bag and you let go of it, it doesn't have that elastic recoil. It stays that big and saggy. It's been damaged. Does that make sense? I find that's always the best way to explain a healthy non-emphysema versus emphysema. And so what happens is typically you have all your vessels, they surround your alveoli. So you have oxygen coming in, carbon dioxide going out, like this is depicting here. But somebody with emphysema, because all this alveoli is damaged, you have a hard time with that gas exchange. That's why often people with emphysema need oxygen, extra oxygen. And that's a whole other topic, but I just wanted to give you guys an overview. And stop me at any point, ask questions, you guys. And the typical triggers for COPD, any kind of illness, as you guys all know, colds, influenza, flus, pneumonias, any kind of air pollution, indoor, outdoor. I say indoor, and that's what we see. I've seen a lot of folks come into the asthma clinic or lung health clinics, and they have this severe lung disease, and they're a lot of these women I've worked with are from India, and they've never smoked a day in their life, and they have outrageous COPD. And so you look back, okay, what were you exposed to? What were your triggers? And a lot of them over the years growing up and living in India, they were cooking indoors, right? Indoor combustible, that indoor air pollution, and that is what they're linking their COPD to, unfortunately. So we don't have that here. I've had a few people that I've spoke with, and they have wood stove still. It's been a bit of a discussion as far as we might need to look at that, because that might be part of your trigger. Wood or kerosene home heaters are triggers, and things that you may be allergic to. So pollen, molds, dust mites, pet hair, just like asthmatics. So how's that so far, you guys? Any questions? So I won't talk too much about asthma because that's not really relevant here, but I like to use this diagram, and it's quite busy, but it just helps look at how we manage asthma. And we'll do one for COPD as well. So on the bottom, we'll keep it simple here. You confirm diagnosis, and with asthma, that is a spirometry, a breathing test, pulmonary function test. And if someone is under 6, for children, we look at their family history, their personal history, and their response to treatment. So once we have a diagnosis, we know it's asthma. Whoops, I lost my mouse. We can talk about environmental control, right? So what is causing it? What are your triggers? What can we avoid? What can we eliminate? Education is the biggest thing, right? That's why you guys are here. That's why we're with Jenna and Tina. And then your action plan. And I'm sure you guys all have one for COPD. We can talk about that. And then the next step on the continuum is your bronchodilators or your Symbicort. So that's your fast acting, your reliever medication as needed for any symptoms. And then as somebody becomes less controlled with their asthma, we add on medications. And so we'll add on an inhaled corticosteroid, an anti-inflammatory puffer. And when they're mild, not very many symptoms, a low dose. And as they get worse, a medium dose and a high dose, right? We just keep going up this continuum. And if their asthma gets worse, they have more symptoms, depends on the year, it could be a seasonal thing, we can add on more medications up here, right? And at every visit for any education session, we always talk about control, exacerbations, what's causing exacerbations, how can we prevent them? Have they had a recent breathing test, a recent spirometry? Inhaler techniques, and I'm going to preach about this a lot today. Inhaler techniques should be looked at every contact with your healthcare provider, whether it's your physician, your pharmacist, or your educator. Adherence, are they taking the medication properly? What triggers, any other comorbidities? So yeah, and then I always feel, and I always talk to my clients or my patients, that if they're well controlled and they're doing well and they're up here on the continuum and things are going well, talk to your doctor about going back down to a lower dose if you can, right? Not everybody can, but you don't have to get stuck up here with any kind of treatment with this kind of a lung disease. You can come back down again. Severe asthma, we won't talk about that. Here is COPD. So same idea. This talks about how we look at COPD, how we manage it. So COPD is diagnosed based on spirometry. Has everybody here had spirometry?
One.
I would imagine. Okay, Barb's had many. Yes. Yeah, so we look at your spirometry, and then so you have COPD from mild to very severe. That's a continuum. So we look at your exacerbations, your acute exacerbations of COPD, mortality. And so low, mild, low risk, and as COPD is worse, you do have a higher risk of having exacerbations. The CAT score is certain, the COPD assessment tool. We do that on our assessments to see where you are as far as your thoughts on how your breathing feels. Dyspnea, how your shortness of breath is, how do you feel? And then lung function impairment, mild to very severe as the disease progresses. If it progresses, hopefully we can get that stabilized. So the first step here is self-management education, and I'm a huge proponent, as far as getting the education, learning how to self-manage. You often can't get into your doctor if you get sick on a Friday night. You can't see your doctor right away. So learning what to do at home so you can treat yourself. Otherwise, you end up in emergency. Sometimes you still do, but the hope is you learn how to manage yourself. Smoking cessation. I don't know, does anybody smoke here? You can be honest, no judging, but smoking cessation is a big thing. And as a tobacco educator, I work with a lot of folks with diagnosed COPD who are still smoking, and it's not easy. And we work with them as far as what they can do, even if they can't quit, but to reduce, even reduce to quit. I saw a lady recently and she's in her 90s. She's like, Stacey, I'm not going to quit. I'm like, okay, how about reducing? Let's just reduce a bit. Let's work on that. Exercise, exercise is huge. Active lifestyle, getting all your vaccinations. That's a personal choice, but we do talk about vaccinations. And at this point, taking your inhaled short-acting bronchodilators like your Bentyl and your salbutamol, your Atrovent as needed. And then up here as well, the next step is your inhaled maintenance medications, and we're going to talk about those, your preventative pharmacotherapies, all the different inhalers. And the next step is pulmonary rehabilitation. You don't need to wait till you get to more of the moderate COPD to start rehab. I would love to see more folks with mild, just diagnosed COPD start pulmonary rehab. But the reality is a lot of these folks, right, Tina and Jenna, right? But a lot of these folks are still working. So we're trying to figure out how to work with them. Do we get a lunchtime class? Do we do an evening class? A lot of folks with COPD don't like going to a public gym, especially if they're coughing. They have a lot of mucus, especially with the whole COVID. If you're coughing, everyone thinks you're sick nowadays, right? So pulmonary rehab is one of the biggest things I find helps with COPD. And there's other pharmacotherapies, other medications. If someone's getting into the more moderate to severe COPD, you often see them adding on oxygen therapy, non-invasive ventilation. That's like your BiPAP medication modality, sorry. And the very top is surgical endoscopic therapies. And the big one up here is your lung transplants. Do you guys have any questions with this continuum of management? I think it's just a good description of COPD. The goals of any of these therapies is to alleviate that shortness of breath as much as possible. You want to improve your quality of life. We want to improve your health status. We want to prevent exacerbations because we know with every exacerbation, there's the potential that your lung disease can get worse or for a bit and then takes a while to get back up again. And we want to reduce mortality. That's the big one. What do I have next? Oh, so what are my inhaler choices? Here's the meat of our talk today. So I'm going to talk a bit about the different categories here, and then we'll have some pictures of all the different inhalers and we can get into all your questions. So the first one is your short-acting bronchodilators. Those are your rescue medications. They're fast, they work quickly, within 10, 15 minutes, sometimes a bit longer for some people, but they're short-term relief of symptoms. So we call them SABA, so short-acting beta agonists, your SAMA, short-acting muscarinic agents. Those are all those fancy medical terminologies. Do all of you have one of these? Give me the thumbs up or...
Yep.
Yeah, okay, good. And then your long-acting bronchodilators, those are the same thing, but they work over longer, either 12 or 24 hours. They reduce the swelling in the airways and prevent symptoms from occurring. They need to be taken every day, even when you feel well. And that's a hard one for some folks. Like, well, I've been taking them for a couple of months. I feel great. I'll stop taking them. It's like, no, we have to take those every day, even if you feel well. And the next one is your anti-inflammatory medications, your inhaled corticosteroids, your ICS. And those reduce the inflammation, the swelling, and the mucus production. They start working within a couple of days, 12 to 24 hours, and it's slow and gradual effect. So they don't work right away. They take some time because you have to remember that swelling and inflammation, all that hot mess in there didn't happen overnight. So we're not going to treat it overnight. It's going to take some time to get on top of it. And same thing as your long-acting bronchodilators. You have to take these every day, even in the absence of symptoms, for them to be effective. And now we're really fancy with our medical with all of our stuff that we have. And so we have all these different combinations. And so I threw these in here just to, you have your SABAs and SAMAs, LABAs, ICS, and we're going to talk about all the different inhalers. And then now we have our triple therapies. We throw everything at you. It works really well. So is that okay? You guys all confused now? Let's look at some pictures. So here is the asthma one, since I'm just going to skip over this and we'll head to the COPD inhalers. So I'm sure you guys can see some of your inhalers. I don't know if you guys would mind sharing which inhalers you guys are on. Alan, you were saying you're on Zenhale?
No, I'm on salbutamol.
Yeah.
And this one is Inspirato Resimat.
Yeah, Inspialto Respimat. That's right. And that's right down here. So Inspialto, that is your LAMA and LABA. So your long-acting muscarinic and your long-acting beta agonist. So those are two long-acting bronchodilators. That's fantastic. How do you find it works, Alan?
Quite honestly, I'm wondering if it does any good at all.
Oh, no. How long have you been on it for?
I started on it in, I believe it was December.
Okay, so it's a while.
It was December, and what I really find is like I walk 5 miles or 3 miles every day, and
That's awesome.
don't find any improvement like around the house here. If I go to run up and down the stairs once, I'm huffing and puffing by the time I get up the stairs. Anything that I do with any exertion, it causes me stress. It causes me to really have a shortness of breath. So I started taking my salbutamol more.
Okay.
And I don't find much relief from that. So
that might be a conversation with either your family doctor or your respirologist about maybe adding on. You might be one of those ones on that continuum. You're at that point right now. So maybe it's time to add something else on to see if you can alleviate some of those symptoms.
okay.
Right? Talk to your doctor about that because we have so many choices nowadays. And the other thing is the Respimat, that inhaler type, is that working for you? Because if you see in this chart, there's other ones in that same class. So he may, or she, or a doctor may want to try a different puff or a different inhaler type to see if another one is a better one for you. You never know. And that's what's nice. I always say to folks, don't get stuck on the same one if you don't feel like it's working for you. Maybe that is what it is for you, but if you never know until you try something different.
He tried me on a different one for a while, about 2-3 weeks, I think it was. Now I can't remember which one it was, but it looked like it was that dental discus that he tried me on for a bit.
Like a trilogy down below here, a triple therapy.
Yeah, and it didn't do much either. So
Okay. What about yourself, Bev? Which ones are you on?
I'm on the salbutamol.
Yeah.
And I've just recently started the Respiratory. I was on the trilogy, the powdered one, but it got to a point where I couldn't get it in. I couldn't breathe out enough to get a good inhale in.
That makes sense. Yeah. How do you find the trilogy? Or sorry, how do you find the Respiratory now?
It's okay. It is better than the trilogy. I didn't like the powder.
A lot of people don't. You're right.
Yeah.
The Respiratory is nice for that. It's more of a fine mist, right?
Yeah. But there again, in holding my breath, I have troubles with that because I cough so much that when I hold my breath, that brings phlegm up. So I maybe get to 3-4 seconds and then I have to cough. So I didn't know if that was doing any good or not, but the inhaler. So my doctor said I could use the aero chamber, with the Respiratory.
Perfect. I was going to suggest that. Perfect.
I do use the chamber, but on days when I feel better and have more air, I try without the chamber. And you
can use the chamber all the time. You don't need to not use the chamber. I would use the chamber all the time. I feel what I always get folks do with any kind of MDI, metered dose inhaler in that style, is the chamber. I find it works really well.
Yeah. Okay.
Another thing you can do is you can take a couple of puffs of your salbutamol, clear your lungs out, cough everything out, right? Do any of your airway clearance techniques, your bronchial hygiene, I call it. Clear them out and then take your
Respiratory, yeah. I have been trying that because I do cough a lot and cough up a lot of phlegm. It can take an hour almost to
It's
clear
crazy, isn't
all
it? You
away.
can't
Yeah,
imagine how much can, like, where is this coming
no,
from?
that's exactly what I think. When's it gonna end?
I know. Yeah, really, that would be my suggestion. Yeah, and we can talk about the aerobic afterwards too. But yeah, I think that would be a good idea. What about yourself, Barb? Which ones are you taking now?
Ultibro and Elvesco.
Oh, you're still on the Elvesco. That's good.
Yeah, I do have Ventolin. I do take it before I do my exercise classes, but the test, the pulmonary function test, it only showed like a 3% difference. So,
Yeah.
I mean, it's not giving me very much good, but I take
It
it.
can't hurt.
Yeah, 3% is better than nothing, right?
Exactly. Okay.
Yeah.
And
But
you're
I
happy with the LT Bro?
Oh, yes, I'm happy with them. Yeah,
Good.
I've been
Good.
on them for years now. I
Yeah.
suggested at one point, I think it was still when I was back at Ridge Meadows, to my respirologist that perhaps I change, and she wasn't happy about my request. I think we had that discussion before.
We did, yes.
Yeah.
Some respirologists, it's too bad. Sometimes they're not as open to, because you guys are getting lots of education. And so if you go with your ideas and if they're not open to hearing them, it's unfortunate, right? At least have that conversation and why they don't feel, yeah, it's worth a try. Always try to talk to your physician. Yeah.
At
What
this-
about yourself, Jean? Oh, sorry. Go ahead, Barb.
I was going to say, at this point, it's working for me. So I'm happy with no change.
Yeah.
Yeah.
Yeah, exactly. As long as it's working. What about yourself, Jeannie?
I was on Symbicort for more than 10 years because I was initially, I guess, diagnosed with asthma. But then when I started seeing the ILD clinic, they said that the asthma wasn't, I guess, as significant. And so then they switched me to the Brio Ellipta, and I wasn't getting much results out of that. And then when I asked my pulmonary rehab nurse to check my technique, she said that I didn't have enough power to breathe the medication in. So she told me to ask the doctor for a change of inhalers. So then I got put on Zenhale. So I've been on Zenhale maybe about 5 years now. And
Okay.
yeah, so just recently, the last refill I had, I was pleasantly surprised that the doctor had lowered the dosage from 2 puffs a day to 2 puffs twice a day to 1 puff twice a day. And he hadn't told me that, but when I picked up the prescription, that's what I was told.
And do you find that's sufficient? You're okay with that?
I'm not totally convinced that I'm sort of ready for this, but I'll try it for
Give
another
it a try.
while, another week or so. And if it doesn't
Yeah.
work, I'll request to go back to the 2 puffs twice a day.
Yeah. Oh, that sounds good. So I think, what else do I have here? Oh, this is for asthma, but I love this little book, you guys, if you ever want to look. It's on asthma.ca, Asthma Canada, and it's Living Well with Asthma. And I helped make this book a few years back, and they wanted to say a guide for asthma in seniors. And I'm like, no, do not say seniors, say older adults, because that's me right now, an older adult, right? So that's why this book is really good. If anybody in your life. And I think I'll stop sharing here. You guys all, there we go. Yeah, so that's kind of what I wanted to show you guys and just kind of see where you guys are at as far as inhalers and any questions you have. I think the biggest takeaway is there's lots of options out there nowadays. And, like Jeannie, you said you talked to somebody and they didn't feel like you were getting that medication in. And that's why I feel every contact you have, whether it's your physician, your pharmacist, your educator, if you have questions for Jenna and Tina, show them how you're taking your inhaler. Because, either we can tweak the method, or maybe you just don't have that flow, that inspiratory flow to get it into your lungs. And there's other options out there now, which we're so fortunate.
Yeah, that's a great point, Stacey. The inhaler technique. And that's, we do inhaler technique workshops every month because, like you say, if you're not doing the technique properly, you might be spending your money and time trying to get this medication into your lungs, and it might just not be getting there. So
Exactly.
might be a quick fix.
Yeah, yeah. And I do love the chamber, you guys. I use this for everybody. I keep them because I work in the community. So I'm going to people's homes and I always have extras because, you know, with any of your salbutamol, your rescue, I know this is a pain to take into your back pocket or your purse, but if you can have it with you or in your car, you get more medication, right? It's, I'm sure Jenna and Tina have been preaching this as well. So the spacers are good. And
There's a compact version of the spacers now, isn't there?
there is, Trudell makes it. Yes. Yeah, it's a bit smaller.
I think it's called To Go, Spacer to Go.
Yeah, I don't have one here, but you're right. There is
Oh,
one.
Yeah.
Jenna
There,
has one.
Jenna
But-
has it.
Here's what, yeah,
Not all inhalers
There.
fit in it though.
that's right. Yeah. Does the registry fit in or no? Do you
No,
have it, Bev? No.
no, because you
Yeah.
have to take the lid off and there's nowhere
Mhm.
inside to put the lid. Even the
Yeah.
sal-
Oh, that's right, because it's kind of
Even-
attached on the registry. Yeah.
Yeah, even the salbutamol, you have to take the lid off to carry it. Like,
Yeah.
Oh, that makes sense.
Yeah,
Yeah.
you're right.
Did you
I
have a
feel-
question,
was-
Barb?
I was just gonna say, some pharmacies carry an aero chamber that's only about 4 inches long and it will fit into a lady's handbag.
Good.
I did pick one up and you know, I'm sorry, I don't remember. I was in Vancouver and we stopped in this pharmacy and I thought, oh, perfect. There's just a small little aero chamber.
Yeah, no, that is good. It's good to ask your pharmacy if they have something.
Yeah, or they
For sure.
could maybe order it in for you.
Yeah. Yeah, I always say use your pharmacist. They have more autonomy now and, you know, hopefully they work with you, what you need. No, for sure. Yeah, and there's so many, like when I travel around, I always have my like demos with me so I can, you know, teach back, right? So I always do it and get someone to show me back what they're doing. And I think the biggest thing with the powder ones is rinsing your mouth afterwards. Anything or most inhalers is not a bad idea. The salbutamol you don't need to, like a bronchodilator, but anything with an inhaled corticosteroid, anti-inflammatory, really rinse, rinse, rinse. And I say gargle.
Yeah.
I'm always a bit hoarse. I'm asthmatic and I was quite sick this summer with COVID. So I was taking lots of my inhalers. So I'm hoarse again. It's going to last for a few months. And so what I do now is I rinse with mouthwash. I find that gives me a bit more relief than just water. And some people say salt water. Yeah. It's hard when you're out and about, but if you just have some water, even just a good swish around, that does make a difference
Yeah.
too.
Yeah, for me, one of the differences with the rinsing is the timing from the time I take the inhaler till I rinse. And for me, I do my breath hold while I'm doing the rinse. Even waiting those 10 seconds, and I'll start to feel some side effects from the medication if I don't rinse right away. So, you know, it's about finding out what your problems are and then finding a way to change it up just enough to fix it. Yeah.
Exactly. Yeah. Oh, for sure. And I do like the new ones. Well, it's not even new anymore. The little the breeze hailers, the one that the Ultra and you know the Seabree that comes in. Enerzair and Atectura now. I take Atectura, but I do like these ones just because of the feedback mechanism. I'm sure, Barb, you recognize that as well because you put the capsule in and you feel it break, and then you can hear it when you're inhaling. It has a whirring sound, and then you can taste it, a little bit of a lactose taste, right? And then when you open it, you can see if it's empty. So I do like this one. There's some benefits because, yeah, everyone has their benefits, of course, and their drawbacks. Yeah.
I'm curious, other than the the mouth side effects, is anyone else feeling like they're experiencing any other side effects from using your inhalers?
I used to find that when I would inhale, I would feel the powder in my mouth, and then I would be thinking, is the powder actually going down or is it stuck up at the top end?
Yeah,
Because I would
exactly.
find as the day went on, I didn't feel much better after taking the inhaler as before the inhaler. And what I
Right.
find too is that oftentimes, this is like early on when I started using the I guess I was on Ventolin in the very beginning, but the doctors don't explain to you how to use the inhaler. So you just try to read the instructions on your own and figure it out. But I think I've told Tina and Jenna over the years, it's taken me more than 10 years and I still haven't mastered it, how to depress the canister in the inhaler and inhale at the same time. I cannot do it. So anyway, like I use a spacer now, and that's the only way I can do it, but I can't do it without it.
Perfect. The spacer, that's why they're there, right? I find the one that people have the most trouble with is the Respimat. So unless the pharmacist loads it for you, they can be challenging, right? So you have to ask the pharmacist to help you.
Yeah, there's a certain amount of force required on those ones.
Yeah,
Is that what you find, Bev?
I tried it one time, yeah. And there is a lot of force. I had to get my husband to do it. So
Yeah.
if he wasn't around, I was out of luck.
Yeah. I had a drug rep from a different drug company come visit me at the clinic. It was at Ridge Meadows, and he hadn't ever loaded one before. So I threw it to him and said, okay, it was a placebo, a sample. Show me how to do it. He couldn't figure it out. He had to pull the instructions out. He had this big, huge set of instructions. He's trying to find his glasses. This is Joe. You guys probably know Joe he used to work GSK. But yeah, so there's some of them, they're challenging. That's where the pharmacy comes in handy. I did a bit of a dive. Sorry, go ahead.
Oh, I was just going to say, along those lines, anyone having trouble loading and priming their inhalers, you could always get your physician to actually write on the prescription for you to load and prime the inhaler, because that's the special instructions to the pharmacist. Some pharmacists will do it, and some it's not regular practice. So if it's written there on the prescription, then for sure your pharmacist will do that for you. So that's kind of a nice thing, a nice service to have.
Oh, for sure. I did a bit of a dive on the pros and cons of inhalers because we're talking about inhalers. So the pros I found about taking inhalers, if they're prescribed, is increasing your quality of life, increasing lung function, decreasing your symptoms, decreasing the use of your rescue inhalers if you're taking your maintenance medication on a regular basis, and decrease in hospital and ER visits. The only con I found was the chance of thrush, the back of the throat, hoarse voice, sore throat. So, and that is resolved by gargling and rinsing on a regular basis. So it's pretty, I always, when folks are hesitant on taking inhalers, I always talk about this, the side effects versus taking a systemic or a pill. The inhalers are pretty good. Yeah. You don't have to, oh, there's something in the chat here. You don't have to worry as much about the side effects. Oh, the cost of medications. Yes, of course. That's always a hot topic as well. So not everybody has coverage. Not everybody has making sure that your doctors, if the medication, there's special authority, that's a whole other topic. So making sure if it's a special authority medication that your family doctor does that special authority. Or if a specialist writes the prescription, a respirologist, an allergist, any kind of specialist, they don't need special authority. It's automatically in there. So asking those questions. I'm not sure if Tina, if you have some more comments on that.
Oh, that's good. Yeah, I was just talking about, Barb brought up that great point about the cost. And I was thinking too about like maybe certain medications are covered, if you have coverage, and certain medications are not. That might be a decision.
And you can usually look those up, which are and which aren't by pharmacy anyway, and your extent coverage if you have it.
Yes. Yeah. So it's good pays to know your what your payer will pay.
Ask those questions because there's so many choices and some of the new ones are not covered yet, even if your respirologist has prescribed them, right? Or your family doctor. So asking the pharmacist, and they can look up as well which ones are covered under benefits.
I wonder if at this time, Jenny used the word prime your inhaler. I've been taking inhalers for 13 years, and I only learned earlier this year that I needed to prime my inhaler. I always just brought it home. When I was going to use a new one, I did my 2 puffs in my chamber and away I went. it took me 12 and a half years to learn that I needed to prime it first. So I don't know who was supposed to tell me, the pharmacist, the doctor, the respirologist, but maybe Jenna could just take a moment and tell everybody what priming your inhaler is.
Sure, yeah. So certain inhalers, the MDI, so the meter dose inhalers, as well as the Respimat. So any medications coming in the Respimat device. As I sneakily inch towards my little inhaler bag, I'm gonna get them out to show you. So those inhalers have the medication inside, as well as often a propellant, something that a carrier that carries the medication into your lungs. And the carrier and the drug attach. So that's often why you have to shake up those inhalers so that they can attach. So that when you breathe it in, you're getting a nice dose of drug. What happens though, because of their chemical properties, is that they often can unattach from each other quite easily. So what that means is when you want to take your first dose out of that inhaler when it's brand new out of the box, you've got to shake it up so those two things mix together. And then you want to push a couple puffs out into the air. Usually it's around 4 puffs or so, but your insert will tell you exactly. And that makes sure that that the puff that you next receive is a nice full dose of both the carrier and the drug together, so that you're getting a full puff, a full dose of the medication. And again, that's because of the properties of often the medication and the carrier of that medication in those devices. The powdered devices often don't need priming, so you don't have to worry about it with those ones. Yeah.
So how do you guys finding out if your inhaler is empty or not? What are your tricks?
On the ones that don't have a meter, I would write it down. Like use sticks, like 3 times, 4 times a day or whatever it was. Yeah.
Perfect. That's the best way, but not everybody, a lot of people forget, or they just take it as needed and they don't keep track.
And if there's 200 doses, like the salbutamol, if you prime at 4 puffs, then you've only got 196 left. So yeah, that's where I start from, 196.
Nice.
That's good.
That's doing it right.
That is right.
Well, it took me a long time to learn that, but I figured that was the best way for me to figure it out.
There's a lot of overhead with taking certain inhalers, right?
I know. So the old inhalers, before they changed their propellant to more environmentally friendly, you could stick them in a bowl of water, and if it was empty, I'm not even sure if you guys remember this, Tina and Jenna. So do you remember this? It's so long ago. It would float, right? And if it was empty, and if it was full, it'd be straight down, and if it was half, it'd be like that. But you can't do that now. Those propellants don't work, right? So you have to either keep track, or you can take it out of the chamber and you can shake it and you can kind of get a feel, but it's not science. It's not exact, unfortunately.
And you can still, it always feels like there's something in there, and it might just be the propellant and no medication. And this is where people want to use it right to the end, but you might not be getting any medication in that.
They're like, it's not working anymore. Well, it might be empty. Just be cautious, really cautious of that.
If we take in just the propellant?
You might just be getting propellant,
Right, but would that hurt us?
No, it wouldn't hurt you,
but you won't get any of the benefits from using it.
It's horrible.
I do what Bev does. I keep them in the box, and I don't know if you can see that, but I write the date on the flap of the box.
Awesome. That's good.
I use sticks for every day. Like I write down like for a whole month worth. Like
good.
And then I write down sticks, like ones. So I use it 2 times a day, and 2 puffs, 2 times 3 is, I just multiply it. And
So Barb was attending my pulmonary rehab class for many years at Ridge Meadows. She was my secretary. She took care of me. So she always I said, how do I get this organized? And Barb would take care of it. It was awesome.
She does that for us too.
Perfect. We all need Barb. Yeah, I need to borrow her sometimes.
Nope, she's ours now.
Can you guys think of anything else you want to talk about with inhalers? Any other questions? Even if it's not about inhalers, feel free.
Yeah,
We
we
got
Oh,
a
you were
few
talking
minutes.
about triggers earlier, and I find now that whenever I go into like a friend's home and they're burning candles, or a restaurant that has candles on the table, that's a really big problem for me. And more so, I think beeswax candles are not as bad, but the regular candles really bother me big time.
I
Yes,
agree. I agree.
scented
Anything you can
candles.
smell, they can bother you, right? And a lot of folks can't have scented candles, or if you go someplace, you just have to ask, I have lung disease. I can't be around those strong scents. What drives me crazy is you walk into the Bay or even like Shoppers Drug Mart, and the very first thing you walk into is the perfume section,
Cosmetic
right?
department.
Yes, cosmetics and all these fragrances. And hold your breath and get through there as quick as possible.
Yeah. At least now they have some really nice, real looking fake candles,
Yes.
which are great. They're very safe and they don't emit anything other than light. Yeah, so that might be a good option if you were looking for candles in your home anyway. Yeah.
Yeah, oh, for sure. And even we were very fortunate this summer with the wildfire smoke. We didn't have a lot of smoky days here, but I feel for folks that have lung disease, and if it's a smoky day or if you're traveling, that's challenging. That is really challenging. Yeah.
Well, we were up in Jasper 2 weeks before it burned.
Oh no,
Oh.
Alan. Oh, jeez.
I have pictures of me having to wrestle one of their rowdy Jaspers to the ground. They have statues of 7-foot Jasper bears that they've had since the 50s. They lost one, fortunately, because I don't know if they could replace him now. But I have spent my summer on a site, and I'm just trying to draw it up here for you. It's an air quality index site. And it tells me all the time what the air quality is. That's what it was at my sister's, and still is. But it gives me the air quality all the time, every hour, for here and any place I go. And it has been a blessing to me because I carry a supply of N95 masks, and if I need one, well, it goes on. Right now, our air is, we got great air here. When you consider reputation.
Oh, yeah.
We have wonderful air, but I live with that. And anytime it goes over 65, I'm in a mask. And I found that it's made the summer, uncomfortable but bearable. So I hated
Yeah.
having a mask because there's so much I can't do with it on. But on the other hand, I can at least go outside, do grocery shopping, that sort of stuff.
Yeah, for sure.
Perfect.
That's a really good idea. And I have on my phone, I have the Canada weather app. What's it called? What's it? It's Canada.
Environment Canada?
Say that again, sorry.
Environment Canada?
Yes, yes. And they have the air quality as well. And same idea on my phone right now. I'm not sure how much, well, you can see that. But right now, Pitt Meadows is 1. And you can set an alert on it. And so as soon as it gets to be a level that you set, so moderates where I set mine 4 or 5, it gives me a message on my phone saying air quality is 4 or 5, so I'm aware. Yeah.
So both of those, the one that Alan showed, IQ Air, I really like that one as well because many of our regions don't have the Environment Canada monitors. So the region where
Yes.
Alan is, for example, there's not a monitor close by. So what IQ Air is, those are the purple sensors, if you've ever heard of those. And it's a bit of citizen science where people can buy these air quality monitors. You can have them on your person or in your home. And then you get localized readings from all these people living in the area that shows up on this website, IQAir. And it's worldwide readings as well. So it's a really good one for when you're traveling. And it's kind of neat to see because they also kind of list like every day, like which country has the worst air quality, which is really kind of sad, but also kind of interesting. But for those of us, like Stacey was saying, I am in the process of putting the WeatherCan app here in the chat. That's a really good one because, I should say IQ Air is mostly looking at PM 2.5, whereas the WeatherCan app and Environment Canada with their sensors are looking at a couple different pollutants. So if you have a sensor near you, that's probably the best one. And it's got the nice AQHI, the Air Quality Health Index, where it gives you that number from 0 to 10, so you could determine your risk.
Yeah, that's fantastic. These are great tools to have so you can avoid your triggers.
Yeah.
So you know that, okay, it's an indoor day, or I'm going to go to the mall today, or yeah. No, for sure.
Yeah, and it's, it's a good point that Ellen brings up. The mask can be restrictive, but then it can also be freeing, and it's like using the apps, use all your sources, get the information, make your best decisions at the time. Maybe if you know that some poorer weather might be coming, if, the fires are building up or something, do your groceries earlier that week so you don't have to go out. But it definitely does take some time and effort to stay on top of
A lot of
it.
work. Yeah.
Yeah, it's a lot of work. But it can be nice, if you know, then
Yeah.
I could go to the store on Monday without a mask. I'd rather do that.
No surprises.
Yeah.
That's right.
I find
Don't
Speaking
get
of,
caught without N95, right?
yeah, speaking of wearing masks, we're heading into flu season right now as well. So have some masks handy. So for asthmatics, I always talk about the September spike, the third week of September, which are we in that already?
Yeah.
Wow, you guys.
Mhm.
So the third week of September has the highest rate of asthma incidences in emergency. I never used to believe that until I started being an asthma educator. And sure enough, the third week of September, the emerge was full. And then the one year that they had a teacher strike and there was no school starting until October, 3 weeks after school started, we saw a spike.
Wow.
That's when we see it. Oh wow, here we are. So just be aware if you have any young kids in your family, grandkids, be cautious if they're sick because there's lots of stuff going around right now. Keep those masks handy.
Yeah. And it'll hit the kids around now, and then it'll maybe be a couple more weeks and it'll hit the older population. Yeah.
When I was at pulmonary rehab earlier in the month, one member had this it looked like sort of a plastic circular frame that if you wear it inside like a cloth mask, it makes your mask stick out a little bit so it's not flat against your face. And he said that he can't wear masks if it's flat against the face, because especially when the air is moist, or even with our breathing, the masks, the flat ones, get moist and they do feel uncomfortable.
Yeah,
Well, especially if somebody's having a hard time breathing and they're breathing a bit quicker, you almost feel like you're suffocating, like you're breathing in the mask, right?
Yeah.
So I see that if any kind of shortness of breath, the mask. And so I have seen those things. Amazon sells them. I've seen them on Amazon, where they put inside the mask just to give you some space in between. That's a good idea. Thanks, Julie.
N95 masks they have some that look kind of like a triangle, I guess. So it's the center part is nowhere near your mouth or nose. And then they have one that's called the duck beak.
That's right.
It also it's further away from your nose and your mouth.
Yeah,
Yeah.
makes it more comfortable. It literally get some breathing room.
Yeah, it's a little more comfortable. Better without one, but it is more comfortable.
Yeah.
I panic when I have a mask on. I have claustrophobia, so.
Well, a lot of people do, especially with breathing problems, right?
Yeah.
And if you have your oxygen tubing and then you have your mask on, it's a lot. And you have glasses and those are getting steamed up and you can't see. It's just
How do oxygen users manage with the N95s? Because the N95s are supposed to be close to your face, and if you're wearing an oxygen tubing, then you've got the tubing kind of snaking up inside the mask.
It wouldn't be a perfect fit. So unless you're fit tested by a proper fit testing organization, like we get fit tested through Fraser Health every year to make sure our faces haven't changed and we have the proper size mask in case the manufacturers have changed to make sure they're completely fit tested. So the ones you buy that are N95, you're not tested for them. So it's not a perfect fit, right? And so the oxygen tubing is also, yeah, it's not going to be much of a perfect fit, but it's what we have, it's what we can use, and it still works.
Yeah, and some of them have like a little bit of a foam or a little plastic, a separate plastic layer around the edge, and that can help seal it around things like oxygen tubing, or if the oxygen tubing can push in your cheeks a little bit, it might, you're just hoping for the best, but trying different masks that contact your skin in different places might help as well. Yeah.
And still being cautious. If it's a big, huge, crowded area, lots of people are coughing, even with the mask on, you may not want to stay because they're not perfect.
Yeah. I think we're gonna end off there. I'm gonna call up my little PowerPoint. Oops, I was looking for the Canada app. Hold on. As soon as I switch my screen, right? Yeah, I would like to thank everybody for joining us here. And Stacey, thank you so much for joining us today.
Thank you for having me, you guys. This was great.
That was
Thank you.
discussion and all the questions. So thank you so much for joining us. If you are looking for more or have more questions on maybe a more personal nature, we do have a Poplar Clinic, which is an online clinic where you can connect with a respiratory therapist and certified respiratory educators. We also have some classes to get people moving on doing some exercise at home as the winter is rolling in. Indoor activity can be great. So we have our new couch to cardio classes. Those are on Wednesdays at 1 p.m. It's only $30 a month for all of the Wednesday classes. So if anyone would like to join us, check it out on our website at pulmonary.com. And thank you very much for joining us. And just before we end it here, we'll go around our Zoom room and share maybe one little takeaway or something that you felt was valuable information in today's session. So if I look at my Zoom room here, the first person I have is Alan. Alan, was there anything you're taking away from today?
Well, I found out that I have a whole bunch more options than I thought about. So I will be talking to either my RT or my doctor up here and seeing if I can't get something better.
Alan, who's your RT up there?
The Kelly McGilvery.
Kelly, of course. Say hi.
Wonderful lady.
Yeah.
Next, thank you, Alan. Next in my Zoom room is Barb.
Again, like Alan says, the education and the options that we have, as well as remembering to prime your inhaler. Yeah.
Important step. Thanks, Barb. And next in my Zoom room, I've got Bev.
Oh, well, it was the difference between the chat and the chew. This is only my second time here, so. And also the it was the lung function. Those, like when you have your spirometry test, I've only ever had one, and I still don't know what they all mean, the numbers. All they told me is it was 30% for me that I could blow out. So I'm still not, I still don't know what these mean when you have that test, which is which. But I learned the questions now that I can ask my doctor.
Perfect.
Good questions. We also have a video where we did go through some of that. So if you put your email address in the chat box, I can email you a link to that video where we do go through some of those values and explain.
Oh, okay. Yeah, and I didn't ask how often you should have one of those spirometry.
Every time you go to the clinic, you get them.
You do?
Yes, I get them like every 8 months, 6 to 8 months.
Oh, I've only ever had one.
It'll depend.
For over 20 years, so.
Yeah, it'll depend on the person and what's going on with your lungs. So there should be one for diagnosis, and then most often people will get followed up. So if there's a change in medication or there's a worsening of the lung condition, or they just want to make sure that the medication is working properly again, they'll check. But usually that comes through with the respirologist. So
I
do you
don't think there is one in Chilliwack.
Yeah, that might be a missing link there too. So
Yeah.
you could ask your physician for a referral to a respirologist. That would probably be a good place to start.
Okay, super.
Stacey, anything through CRS that could be helpful?
We're not doing spirometries right now, unfortunately, with CRS. I would talk to your family doctor, and he can refer you or she can refer you to a spirometry at Abbotsford or Chilliwack Hospital. There is a wait, but at least get on the list for the wait. It could be 6 months, but at least you're on the wait list. And then you can always, because if you have flexibility in your schedule, when you get booked for the test, ask to be on their cancellation list. Yeah.
Oh, that's a good
That's
idea.
a start. That's a start.
Yeah, yeah. Thank you.
Ideally, I say in a perfect world where we had lots of breathing tests and lots of access, it'd be yearly, but that's not the way things work in our medical system right now, unfortunately.
No.
Awesome.
I
Thanks.
think for me, I go to a specialized ILD clinic, and so maybe that's why I get tested, you know, with every visit that I have, every in-person visit.
Yeah, that makes sense
different
for sure.
clinics will do that too. So more testing isn't a problem. We just want to make sure you are getting some testing and follow up there. And
Oh,
Jeanine, was there something you wanted to? Oh, sorry, Jenna.
just quickly for Bev, I put the YouTube video in the chat box there, Bev, of our spirometry chat and chew.
Thank you.
You're welcome.
Be sure to click it before we end the Zoom, or it'll disappear.
Oh, okay.
Yeah.
Is it possible next time to have the option to copy those links by just tapping on them instead of like opening up the whole site?
Like rather than having it open the
Like in the
website.
chat, like because earlier I wanted to see the link from the weather Canada weather app, but
Yeah.
I wasn't sure that's what that was, so I wanted to just copy that link and then I would look it up later. But then when I tapped on it, I got right into the link, and then I thought, oh no, how am I going to get back to the Zoom call?
Yeah, it's because you're on a
so
portable
that
device.
for a few seconds there, you know, I had disappeared, and yeah, eventually I found my way back. But
awesome. Yeah, if you're on a computer, you can right click and click copy link, but on the mobile devices, sometimes if you hold it down, it will give an option, but I'm not sure if Zoom does.
okay,
Like
yeah,
keep
because
your
I'm on
finger
a
on it.
phone, and so yeah.
Yeah.
But sometimes I find that when I'm on like with different groups, that I could just tap on the link and then I could copy it onto the clipboard and then look it up later.
Yeah.
I see.
Yeah, maybe just a hold instead of a tap, but I'd have to be on a phone to play.
Maybe what I'll do is in our chat and chew event, there's a comment section at the bottom of the event. So what I'll do is I'll post the links there. When you go to the chat and chew section in the Poplar community, just click past events, because after right now it'll go away. But if you click past events, you can go back and see all the events that we've had, and you can access the chat section at the bottom of the event.
Okay, that's good.
So let's try that.
Good
Jeannie,
idea.
you're always coming up with ideas for us. I love it.
Work around.
I feel like I'm the only one contributing. I keep looking for other people to contribute.
You're a big resource and you're very tech savvy, Jeannie.
Thank you.
Thank you
So
for
we're
all
all
those.
looking forward to the ILD day next week.
Yeah.
Yay.
Yeah, we'll be there.
ILD forum in BC. Yeah. Awesome. And the online one too. Yeah. All right. Thank you everybody for joining us. And as we like to say here at Poplar Pulmonary Wellness, get out there and live your best lung life.
Like,